Here's something most people never expect. Your feet can sometimes send an early warning about one of the most serious cancers there is. Pancreatic cancer is often called a silent disease because it's usually caught late, but researchers have found that in some cases, the body drops subtle clues in the legs and feet long before other symptoms appear. This isn't about panic. It's about awareness. Medical studies, including research published in journals like The Lancet and findings from the American Cancer Society, have documented real, physical links between pancreatic changes and lower body symptoms. For adults over 60, whose risk for pancreatic cancer rises significantly with age, knowing these signs could mean catching something early, when treatment options are strongest. So today, we're walking through what science actually tells us, calmly, clearly, and honestly, about the foot and leg changes worth paying attention to. Nothing here is meant to scare you. It's meant to inform you, because knowledge, especially at this stage of life, is one of the simplest forms of protection we have. Let's get into it. The first sign doctors point to is unexplained swelling in the legs or feet. This happens because pancreatic tumors can release substances that affect normal blood clotting, sometimes leading to fluid buildup or circulation problems in the lower body. It's easy to blame swelling on standing too long or eating salty food, and most of the time, that's exactly what it is. But when swelling shows up with no clear cause and doesn't improve, it's worth mentioning to a doctor. The practical takeaway here isn't fear, it's simply tracking your body. If swelling is new, one-sided, or persistent, write it down and bring it up at your next checkup. The second sign is something called migratory blood clots, medically known as Trousseau syndrome. This is a well-documented phenomenon where blood clots appear in different veins over time, often in the legs, and it's been linked in medical literature to underlying pancreatic conditions. It sounds intense, but here's the reassuring part: this is rare, and clots have many far more common causes. Still, if you or a loved one notices sudden warmth, redness, or tenderness in a vein that seems to move locations over weeks, that's a signal to get checked, not ignored. The third sign involves numbness or tingling in the feet. This can happen because pancreatic cancer sometimes triggers new-onset diabetes, even in people who never had blood sugar issues before. When blood sugar stays elevated for a while, it can affect the nerves in the feet, causing that pins and needles feeling many people associate only with long-term diabetics. For seniors, this is an important one to remember. If numbness in the feet shows up suddenly, alongside unexpected weight loss or new thirst and fatigue, it's worth asking your doctor to check blood sugar levels and pancreatic function together, rather than treating them as separate issues. The fourth sign is persistent itching in the feet and lower legs. This connects to how the pancreas sits near the bile duct. When a tumor affects that area, bile can back up into the bloodstream, and one lesser-known effect of that is itching, sometimes most noticeable in the hands and feet before it's noticed anywhere else. If the itching comes with even mild yellowing of the skin or eyes, that combination is significant enough to bring up with a physician right away. The fifth sign is unusually cold feet or a change in skin color, like a bluish or pale tint. This ties back to circulation changes mentioned earlier. When clotting or blood flow is affected, the extremities are often where it shows first, simply because they're farthest from the heart. It's a subtle sign, easy to dismiss as just getting older, but a noticeable, one-sided change deserves attention. The sixth sign is unexplained muscle weakness or heaviness in the legs, sometimes called cachexia-related weakness. Pancreatic cancer can affect how the body absorbs nutrients, which over time may lead to muscle loss that often becomes noticeable first in the legs, affecting balance and stamina. If stairs suddenly feel harder, or walking distances that used to be easy now feel exhausting, it's a physical change worth discussing with a doctor rather than assuming it's simply fatigue. Before we go further, if you're finding this kind of clear, science-based health information useful, consider subscribing. We break down real medical research into simple, honest explanations every week, specifically for adults who want to stay informed about their health without the scare tactics, and subscribing means you won't miss the next one. The seventh sign is skin texture changes on the feet, including dryness or small nodules, which some studies have linked to fat malabsorption caused by pancreatic dysfunction. When the pancreas isn't producing enough digestive enzymes, the body struggles to absorb fat properly, and this can show up as changes in skin quality, particularly on the lower legs and feet. The eighth and final sign is a general sense of heaviness or fatigue that settles into the legs before it's felt anywhere else in the body. Many people describe it as their legs feeling like they're dragging, even after a full night's rest. Fatigue is common and has countless harmless explanations, from poor sleep to low iron to simple aging. But when it's paired with several of the other signs we've discussed, especially swelling, numbness, or skin changes, it becomes part of a bigger picture worth paying attention to, rather than something to brush aside as just another tired day. It's important to say clearly, none of these signs, on their own, mean pancreatic cancer. Swelling, cold feet, itching, and fatigue are common and usually caused by far more ordinary things, like circulation issues, aging joints, medication side effects, or minor nerve irritation. Most of the time, there's a simple, harmless explanation. What matters is the pattern. Doctors and researchers emphasize that it's the combination of symptoms, and how they persist, worsen, or appear together over time, that carries real significance, not any single sign in isolation. A little swelling after a long flight means nothing. Swelling that keeps returning alongside unexplained fatigue and skin changes is a different story entirely. This is exactly why awareness matters so much for adults over 60. Pancreatic cancer is often diagnosed late simply because early symptoms are so easy to explain away, both by patients and, sometimes, in routine checkups. Many of these signs overlap with normal aging, which makes them easy to dismiss. But understanding what the body might be communicating gives you and your doctor a head start, and in cancer care, timing can make an enormous difference in outcomes. Research consistently shows that earlier detection is linked to significantly better treatment options and outcomes, which is precisely why this kind of awareness is worth a few minutes of your attention. The most powerful thing you can do isn't to worry about every ache or change. It's to notice patterns, track anything unusual, and speak up during checkups instead of staying quiet about small symptoms. Keep it simple. If something feels off and doesn't go away after a week or two, mention it. Seniors especially are encouraged by health experts to advocate for themselves, because so many symptoms get brushed off as simply part of getting older, when in reality, they deserve a closer look. You know your body better than anyone else does, and that knowledge is genuinely valuable, both to you and to the doctors caring for you. Here's the hopeful part: awareness like this isn't about living in fear of illness. It's about living with more confidence, knowing you're paying attention to your health in a smart, informed way. You don't need to overhaul your life or panic over every symptom. You simply need to stay observant, stay proactive, and treat your annual checkups as a real opportunity to speak up. Early detection remains one of the strongest tools we have against pancreatic cancer, and simply understanding these signs puts you a step ahead, arming you with information instead of fear. If this video gave you something valuable today, take a moment to like it. That small action genuinely helps this kind of honest health information reach more people who need it. Drop a comment and let us know which sign surprised you most, or share this with a parent, a friend, or anyone over 60 who could benefit from knowing this. And if you haven't already, please subscribe so you don't miss future videos breaking down real medical research in a way that's simple, honest, and genuinely useful for your health journey. Thank you for watching, and take good care of yourself, today and every day.